Well, I want to welcome everyone on behalf of AARP Virginia to today's webinar, where we'll be covering some of the myths, rumors, and misconceptions that surround SNAP program, which I think most of you know is a federal program, but we have folks focusing on Virginia specifically today. And I want to introduce myself. I'm Brian Jacks. My role with AARP Virginia is Associate State Director for Community Outreach. We also will be hearing from Monica Kelley, who represents the Blue Ridge Area Food Bank as Public Benefits Outreach Program Manager. And I want to also bring to your attention Norm Gold, who is a consultant with Feeding America and also serves as an AARP Virginia Community Ambassador. Welcome. We're glad that you're here, and we plan to run this 1-hour webinar with information that hopefully you'll find helpful, also allowing for time for question and answers at the end. You might ask, why does AARP care about the SNAP program and what brought us to focus on this topic today? Well, fighting senior hunger is something that AARP cares about tremendously. We've been involved in the fight for more than a decade, and this ties to our livability goals, as AARP is working to ensure that adults can age with dignity and respect in the way that they wish. We recognize that hunger can uh, eliminate many options as people get older, specifically in terms of where to live and how to meet their needs on the home front, on the health front, even when it comes to being engaged socially. So hunger touches many of the livability pieces, as well as it has an impact and plays into one's brain health as individuals age. We've seen that healthy eating is one of the key determinants of how people maintain adequate and strong brain health as they get older. And so this topic is very clearly aligned with our mission. I want to let you know that today we will begin with Monica giving a presentation, some slides. We will be popping some specific links that can be helpful for your further investigation and study into the chat box as the presentation goes on. And I know that Monica said that she'll be adding some web links towards the end of today's program, just so that what you hear today, you can have access to down the road. We will also be recording the webinar and sharing that with you by email. We'll send that as a follow-up so that if you wish to hear it again or share it with others, we will make sure that that is available. Our overall agenda is to present until about 2:20 and then make sure that we have time to answer your questions. I'll ask that you put those questions into the Q&A box, which should be at the bottom of your Zoom browser. You'll see a question mark with a square, the letters Q&A below that. If you would pop your questions into that section rather than the chat, it will be helpful to allow us to make sure we keep track of them all and give adequate time for answering. And but at the same time, if you put a question into the standard chat box, I'll try to make sure it gets transferred over there and we cover that as well. All right. With that, I would again like to welcome Monica. Thank you for being with us here today. And let's begin your presentation as the Public Benefits Outreach Program Manager from the Blue Ridge Area Food Bank in Charlottesville. Thank you, Monica.
Thank you, Brian, for that introduction. I'm going to go ahead and share my screen so we can go ahead and get started. All right, so let me make sure this is out the way. Today we'll be talking about SNAP, which is the Supplemental Nutrition Assistance Program. So First, I would like to introduce us as a food bank. I work with the Blue Ridge Area Food Bank. I'm located in our branch in Charlottesville, Virginia, but we have three other branches, one in Winchester, one in Verona, and one in Lynchburg as well. We serve about 25 counties and 8 cities along the Blue Ridge through a network of more than 400 community partners and program sites. So as a food bank, if you aren't aware what a food bank does, we secure food from local and national sources. We make sure it's safe, and then we distribute that food to our partner agencies or program sites so that they can distribute to their local communities. We also operate many outreach programs through our mobile food pantries and our neighborhood produce markets. So a little information about our impact. So between July 2023 and June 2024, the food bank served over 172,000 individuals. That's over 31 million pounds of food, but 9 million pounds of just produce specifically as well. So that translates into over 27 million meals provided to our communities. And pictured in this picture here, this is Marisol and her uncle Jose. They visit one of our partner pantries in Stanton. They moved from Florida to Virginia for some healthcare reasons. And with the help of SNAP and our partner food pantries, they're able to get the food that they need. Well, most of the food that they need. All right. So as a food bank, in order to have that huge impact we just talked about, we developed a renewed vision for the future. So despite us distributing more food than we've ever had to distribute in our 42-year history, hunger and food insecurity is still heavily prevalent in our service area along the Blue Ridge Mountains. So for a deeper impact, we decided to utilize other resources or supplemental nutrition resources that are available through the federal government, such as SNAP benefits. Data says fewer than 1/3 of guest households currently participate in SNAP. So if we know we're a supplemental resource, right? SNAP is also a supplemental resource. Why not put those resources together so that people can have all of the food that they need? So this is just one part of our strategic plan. We also focus on eliminating disparities in access to nutritious food, and we also prioritize the health of our guests. So back to SNAP benefits. So as a food bank, we are committed to increasing access to SNAP, whether that's through policy and advocacy and providing enrollment support or improving perceptions of SNAP. Currently, through our webinar today, we will focus on improving perceptions and also talking about information in case that you would like to see if you're eligible to apply for the benefit. We'll also go over some advocacy needs that if you are someone that would like to advocate for policy changes or to strengthen SNAP, we'll go over that as well. So to begin, let's talk about what is SNAP. So SNAP is the Supplemental Nutrition Assistance Program. You may remember it most by its former name, food stamps. So whenever I'm out in the community, going around to our partner pantries or just visiting agencies, when I say SNAP, it's not very, a lot of people aren't familiar with that term, but when I say food stamps, individuals know what it is. So SNAP is also food stamps, and SNAP and food stamps can also be considered EBT. A lot of SNAP recipients know SNAP as EBT because that is the card that their SNAP benefits are dispersed on monthly, which is on the screen, this gray card that says Virginia EBT. That is what SNAP recipients receive in order to utilize their benefits. So SNAP is a federal program, but states have options on how they want to administer the program. So some states have certain work requirements or certain resource or asset test, but SNAP as a program in general is federally administered, and income requirements are based on the federal poverty guideline. So let's talk about what you can do with SNAP benefits. What can you buy? Well, with SNAP benefits, you can buy food. So food, any food for the household, or most food for the household, such as fruits, vegetables, meat, fish, dairy products, breads, grains, snack foods, or seeds or plants that produce food. With SNAP benefits, you cannot purchase alcohol, tobacco, hygiene items, pet food, or any other household items. And you cannot purchase food that is hot at the point of sale. So with your SNAP benefits, if you go to the grocery store and you're in the hot prepared food section, maybe there's a rotisserie chicken under the heat lamp. Well, when that chicken is under that heat lamp, it is not SNAP eligible. But maybe that store has rotisserie chickens that are cold in the fridge that are available for purchase. Well, those items are eligible to be purchased with SNAP benefits because they are not hot at the point of sale. And when I say hot, I mean the temperature of the item. So again, to summarize, with SNAP benefits, you can buy food that is not hot at the point of sale. So you may be wondering, why are we having a SNAP myths and misconceptions webinar? Well, because there is so much misinformation out there about SNAP benefits or SNAP recipients. And here is some of the misinformation that I hear the most. And Norm, feel free to chime in. If you've ever heard of any of these myths or misconceptions, feel free to chime in. One thing that I hear a lot is about SNAP recipients and work. Some things I hear are, oh, those who receive SNAP don't work. Or those who do not work and receive SNAP are able to work but are taking advantage of the system. In fact, 50% of SNAP recipients work. Right. You wouldn't know that if you just listen to what everyone says, right? So 50% of SNAP recipients actually work, actually have a job. In general, SNAP recipients must meet certain work requirements in order to continually to receive the benefit. If you do not have a job and you're an able-bodied adult and you apply for SNAP, you will only be able to receive SNAP for 3 months, unfortunately, unless you provide them proof that you have a job or are part of a job training program. So SNAP recipients do work, and those that do work or those who don't work and receive SNAP, typically they only receive SNAP for a specific amount of time until they do get that new job. So that is a huge misconception. SNAP recipients that are exempt from work requirements, they have barriers to maintaining consistent employment. So including disability, increasing in age, and also caring for the dependents in a home. So although some recipients who receive SNAP don't work, it's for a good reason. SNAP recipients are taking advantage of the system. That is something you hear a lot. You hear that SNAP recipients use benefits on non-essential items, or maybe they're receiving more than they actually need, right? Well, just to let you know, the average SNAP benefit of an individual is $125.80 per month, which is approximately about $4 a day, which translates into $1.40 per meal. So you see, SNAP can assist households in buying nutritious foods, but it generally does not cover the cost of all possible nutritional needs. And that's why we tell our guests utilize SNAP benefits, but also go to as many food pantries as you need to supplement your nutritional needs. That way you can save your money and use that for rent or utilities. There's also some misconceptions regarding SNAP and immigration. A lot of people are scared to apply for SNAP because they think it may hinder their ability to eventually become a citizen, or it may put them up for deportation. But SNAP is not a public charge. No federally nutrition program is a public charge. So if there is a mixed status family that applies for SNAP, maybe they are undocumented, but their children are, they can apply for SNAP on behalf of documented children, which won't put them at the risk of any deportation. Some people also have an assumption that SNAP is bad for the economy, but SNAP actually contributes a lot to the economy. $1 in SNAP benefits translates to about $1.70 some cents when it goes into the economic system. So SNAP dollars go even further than regular dollars sometimes. Some other common misconceptions I hear is, oh, if I get benefits, I'm taking them away from someone else, or you cannot receive SNAP if you're retired, or SNAP is only for families, or SNAP is a welfare program. Well, none of those are true. SNAP is an entitlement program, and those who are eligible for the program will receive the benefit. It's not a welfare program. It doesn't matter if you are retired. It doesn't matter if you do not have children. You're not taking away benefits from those that do have children if you get benefits. It's an entitlement program. There has to be enough there for everyone. Unlike block grant programs, there's not a specific amount of funds available. So if you get SNAP and everybody that's eligible gets SNAP, there's enough to go around. So let's talk about some benefits of SNAP, right? So why SNAP? Data has shown that when families are connected to benefits for at least 6 months, their food pantry visits will lessen, right? So that's something that we use to lead with when encouraging our food pantry partners to start talking about SNAP with their guests. Are your lines long? Is inventory down? Donations are down? Let's start incorporating the other resources that are available to our guests. Let's help educate and connect our guests to SNAP benefits, because that's a resource that's available and will be able to supplement the food that they receive from the pantry. SNAP lifted 4.6 million people out of poverty in 2015. Isn't that crazy? 4.6 million people will no longer considered living in poverty after they receive SNAP benefits. For every one meal a food bank provides, SNAP provides 9 meals, right? That's the impact of SNAP alone. And that is why it's our nation's largest social safety net. It does more than we as a food bank could ever do, right? But together, we can do a lot. But I just want to say one more time, for every one meal that a food bank provides, SNAP provides 9. And again, SNAP is great for the economy. Like I said, each dollar spent in SNAP benefits, it generates $1.79 in economic activity, right? So the data shows that SNAP also contributes to positive health outcomes, like Brian mentioned at the beginning of this webinar. SNAP participants have about 25% less in medical costs a year, and that's about $1,400, and compared to non-SNAP participants. So people who receive SNAP have less healthcare costs than non-SNAP participants that are eligible for SNAP. So SNAP's impact is huge, okay? Going into our next slide, let's start talking about eligibility. How do you know if you qualify for this benefit? So SNAP uses several factors to determine if you are eligible. They will first look at your household composition. SNAP defines household as those that you cook and buy your meals together, regardless of your relationship. SNAP will also look at your gross income, your citizenship status, your net income, and in certain situations, they will also look at your expenses. If you are undocumented, or you are on strike, or if you previously violated the SNAP program rules, you will not be able to receive SNAP in most cases. Certain previous program violators have certain time spans that they can't apply for SNAP. So it might be 1 year, it might be 5 years, it might be 10 years, or a lifelong ban. But those who cannot receive SNAP benefits are most undocumented immigrants and most individuals on strike. To be eligible for SNAP, you have to meet their income requirements. They have a max income. So in Virginia, we use the 200% of the federal poverty guideline to determine if someone may be eligible for SNAP benefits. So if you are a household of one person and your income is less than $2,510, that means you may be eligible for benefits. This income chart gets updated every October. So this past October, this number was $2,430, but it went up almost $100. I'm not really good at math, but almost $100. Federally, the 130% of the federal income, the federal poverty line is used to determine eligibility. But again, because of those state options, Virginia has opted into broad-based categorical eligibility, meaning that we can use the 200% of the federal poverty guideline, meaning more people may be eligible. So for example, if you cook and buy groceries for 5 people, including yourself, and you make less than $6,097 a month, you may be eligible for SNAP benefits. On the far right side of this screen, you can see the maximum SNAP allotments. That means this is the maximum amount you can receive if you're eligible for benefits. If you qualify for the benefit and you are a household of one person, the max monthly SNAP benefit will be $292. There's also a minimum SNAP benefit. Remember the couple I showed you toward the beginning of the webinar, Jose and Marisol? Well, I mentioned that they utilize SNAP benefits to supplement their nutritional intake as well, but they received the federal minimum benefit for seniors, and that federal minimum benefit is $23. So sometimes SNAP benefits are way lower than they should be. This is because when you apply for SNAP, your income determines the amount of benefits you get. There are certain deductions that are considered and can increase your amount of SNAP benefits you get, and we'll talk about those. Oh, sorry, we went right to the end of the presentation. Let me get us back to where we were. Okay, great. So let's talk about how to maximize your benefits. If you are in the same boat as Jose and Marisol and you receive that federal minimum SNAP benefit, there are a couple of things you can do during the application process or after you submit your application to ensure that you receive the max amount of benefits that you are entitled to. The first couple of things are things you can do during the application process. When completing the application, you want to make sure you're citing all of your expenses, especially your shelter expenses. If you have excess shelter costs, meaning that the cost of your housing and utilities are more than half of your income after the deductions, then you might be eligible to receive a deduction. If you care for a dependent, you can receive deductions from those expenses. If you have earned income, a percentage of your earnings can potentially be deducted. There's also a standard deduction based on household size. If you pay child support or pay to live in a homeless shelter, there are deductions based on that as well. A couple of things you can do after the application process. You could utilize your SNAP benefits at your local farmers market that participates in the Virginia Fresh Match program. The Virginia Fresh Match programs allow SNAP participants to double their bucks at their participating farmers market. So if you have a local farmers market and they participate in Virginia Fresh Match, what you can do is take your SNAP card to that farmers market, find the table that has the SNAP sign, or find the farmers market staff that is in charge of the Virginia Fresh Match program and double your bucks. Another thing that you can do to maximize your benefits, especially if you receive the minimum benefit, is allow those benefits to carry over. You can allow your benefits to build up for a couple of months and use them once they've gotten to a substantial amount. This deduction, called the medical deduction, is, I think, the most beneficial deduction, especially for any older adults over 60. So the medical deduction allows individuals who are age 60 or over or disabled to subtract certain medical expenses from their gross income, right? So if you are 60 or older, or you're considered disabled, and you have monthly medical expenses that are greater than $35 and that are not reimbursed by your insurance or by anyone, you need to list those expenses on your SNAP application. So examples of allowable expenses would be medical and dental care. Do you have dentures? Do you pay a Medicare healthcare premium? Do you pay for supplemental healthcare insurance? Do you pay for a prescription insurance? Do you have prescriptions or over-the-counter medications? Do you have any dentures, hearing aids, prosthetics, a service dog, or anything like that that has incurred expenses? Do you have to travel from Lynchburg to Charlottesville to get to a doctor's appointment every month? Well, the expenses that you incur regarding any medical needs, you should write those and list those on your SNAP application so that the caseworker that receives your SNAP application can make sure you receive that deduction. So this is something you can do during the application process to ensure you are receiving the maximum amount of benefits that you are eligible for. So if you are unsure about whether a medical expense can be deducted from your income, you can always ask your caseworker from social services, or just contact your local social service office and ask them as well. All right, and next we have the Elderly Simplified Application Project, ESAP. This is one of my favorites. This is an application for those 60 and over and that have no earned income. So if you're 60 and over and have no earned income, you can complete the simplified application. So if you've never seen a regular SNAP application, it is around 15 pages long, right? And it takes quite a bit of time to do. But the ESAP application is much shorter and excludes some questions, such as those related to pregnancy and education. It also ensures that if you complete this application and you're approved for benefits, you will be approved for benefits for 36 months. Yes. Um, Norm, do you have anything you would like to add about the Elderly Simplified Application Project?
I would think that that's the one thing that's a misconception for seniors, and I can speak for one because I'm almost 70, is it's most seniors believe it's too much work, it's too much, it's really kind of a pain to apply, but this does make it much easier for seniors to apply and to really see that there are benefits available to them that they don't know about. So
Mhm.
the more we can get the word out of this, the more seniors can start getting some benefits they could truly need.
Yes, yeah, I agree. So you can get the ESAP application on paper. The ESAP application is also available through Common Help. One of the first couple of windows, you have to click a button that says you're an older adult that doesn't have earned income, and it gives you the option to complete this very, very simplified application.
I'm going to add into the chat a flyer that the Federation of Virginia Food Banks and AARP created that has some links for them and also has a QR code that they can scan that can answer a lot of questions that really simplify it even more for them.
Great. Thank you, Norm. So again, if you are 60 and older and you're thinking about applying for SNAP, make sure you're completing that ESAP application that is not 15 pages long. So now that we talked about SNAP eligibility, let's talk about how to apply for benefits. So here at the food bank, we provide application assistance and eligibility, pre-screening assistance to those that reach out to us as well, especially if you are within our service network. So from Charlottesville to Lynchburg to Verona to Stanton, you can reach out to the food bank and we will help you determine if you're eligible or potentially eligible for benefits. And we could also help you apply for benefits as well. Common Help also has a call center that applicants can call into to submit an application over the phone. I will say this is the easiest option to apply when there's not a wait time. So just be mindful of that. There's also that paper application that we just discussed. You can get both the regular application and the ESAP application on the Department of Social Services.virginia.gov website. You can also complete the SNAP application online at commonhelp.virginia.gov. So if you think you are eligible for benefits, there are several ways to apply. Just choose the method that works best for you. If you think you might be eligible, in partnership with Real Food for Kids, an organization located in Arlington, Virginia, we've developed a SNAP pre-screening tool that asks you a couple of questions, very simple, to determine your SNAP eligibility. If you take a picture of this QR code here on the screen, it will take you right to the link. And at the end of the presentation, I'm going to share the URL in the chat as well. So go through that screener. It's about a couple, maybe 5 questions or so. And at the end, it'll tell you if you're potentially eligible and if you're not. If you're potentially eligible for SNAP, it'll give you several options on how to apply or where to get the help that you need. This information you learned today is very valuable. You've learned some facts to dispel some myths and misconceptions that are widely spread by different communities and those that may have had a negative experience with SNAP or trying to get SNAP. So after this training today, please share this information that you learned with other individuals in your community or potentially eligible people in your community as well. And then the last thing that you can do after the training today is advocate. Here at the food bank, we have resources to support you with advocating, and I'm going to throw that link in the chat as well. Marisol and Jose, from early on in our training presentation, we heard about their story of getting just that federal minimum benefit of $23, right? We're advocating for that $23 to be raised to $50. So if you wanted to support us in supporting other seniors and supporting the seniors in your life, and maybe the seniors, older adults that are participating in SNAP and need that extra cushion, right? Because $23 can get you all the food you need, especially when you're retired and you're not working. So please advocate with us to strengthen SNAP benefits as well. If you're on this call and you're part of a food pantry or you work with a community-based organization, there are several things you can do as well to support your guests or clients with getting connected to SNAP or just learning more about it in general. Here at the food bank, we provide support to community-based organizations and food pantry partners for them to implement this work at their locations. So whether that's through outreach and education, whether requesting someone from the food bank to come to your pantry to talk to the people you serve about SNAP, or by the food bank serving as a referral destination for you to send people that want more information on SNAP or want support applying. So that's the end of my presentation today. It ended a little bit early, Brian. Sorry about that. I'm gonna
No,
go
there's
ahead.
nothing wrong. You've covered so much, and I really appreciate that. I want to let folks know that in addition to what we've heard, I did copy the ways to apply for SNAP. That was one slide that I just took a screenshot of and then posted into chat so that people would have that readily available and on hand. We do have a number of questions that have come in, and so I just want to go through. Let's start with some of the easier, quicker ones first, and then we'll dive in a little bit more. And Norm, I am going to give you a chance to share a little bit too. Let's say we'll hit these quick questions first, then give Norm a chance to add anything that feels like would be wise to reemphasize, and then we'll hit some of the more complicated or fuller questions. All right, so just as a start, the numbers that you shared in reference to the limited number of people who are actually eligible that even attempt to apply, those numbers were not just for the Blue Ridge area, which your food bank serves, but you were giving numbers generally for across the nation, I believe, or in Virginia specifically.
Virginia.
For Virginia, good. So just again, a recognition that there are a number of people that could be helped by this program that for one reason or another are failing to even apply. And so without trying to brag about AARP, but still showing off the fact that AARP does care, I'll let you know that the flyer that Norm pointed out and is attempting to put forward so that people can get a chance to see that, it's something that we are providing at health fairs and festivals as AARP Virginia volunteers crisscross the state. Um, uh, again, trying to help people on the topics of livability, brain health, even caregiving. And Monica, I appreciate the point that you made in reference to households are changing and individuals' homes often have a different makeup than maybe a traditional arrangement. And you pointed out that there's not a marriage requirement. It's individuals that are going in together for food, and just wanted to make sure that we had spoken to that. Monica or Norm, is there anything that you would be willing to say or put into play here around caregiving? Because I know that in a sandwich generation, oftentimes folks are caring for an older loved one, also have kids in the home, or perhaps grandparents raising grandchildren.
Yes. So if you are a grandparent raising a grandchild, you and that grandchild are eligible for SNAP. Like if you have that grandchild for more than half the time in your home, you need to add that child to your SNAP application so that your SNAP benefits reflect that.
Yeah, and that's a great benefit that most seniors don't know that's available to them. And I think seniors have a tendency to be have a little more pride and are kind of embarrassed to apply. So it's a stigma that they have to kind of get over and accept the fact that the help's out there for them. But it's a barrier to some of them. They're just afraid to ask.
Yeah. Well, thank you for pointing that out and again giving encouragement as one of AARP's primary goals and issues that we focus on throughout the year is around supporting caregivers. One of the quick questions I think you'll be able to answer is in reference to the simplified application. Two people asked, is it available in every state or just Virginia? Are there nuances between states on what that looks like? Um, let me throw that to you, Norm, if I might. I know that you have some experience there.
It's not available in every state. I'm sure you can look it online, but mo many states have it, and they're trying to expand it to all of them. We're just fortunate Virginia is one of them.
Excellent. I see Monica nodding her head, so that looks like we answered that well. In reference to, you mentioned several times different income requirements, and that impacts not only the benefits that one receives, but also what type of application you could fill out. A number of individuals have questions in reference to assets.
Mhm.
So income, assets, and how that plays in. I'll just give you one of them. The question being, what if you own your own home? Does that disqualify me? Again, talking about rumors, misconceptions, help
Yes.
people understand how assets and income are different and how they play into this overall SNAP discussion, please.
So historically, if you owned a home or a car, you would not be eligible for SNAP benefits. But with recent policy changes, certain assets and resource tests are waived depending on your situation. So I don't want to give false information because I want us to be mindful of how SNAP eligibility is very much determined based on someone's specific economic situation. So they will look at your income and your expenses, your age, all of that in order to determine, does this person need to undergo an asset test? Are we using the 200% of the federal poverty guideline? Are we using the 130%? So I can't give you a resounding no or a resounding yes. But most people do not have to undergo a resource and asset test. But again, SNAP eligibility is very dependent upon your specific information. But I've had older adults that apply for SNAP that have owned their own homes and do qualify for SNAP because they don't have enough income. They still have other bills, they have expenses, even though they don't have to pay rent or mortgage, they still don't have enough resources or income in order to meet their nutritional needs.
Monica, I think that was a terrific answer. And again, you've done a great job of pointing out how each individual's circumstances are different, and really each household is different. Not to mention the size and age and what um, costs are associated with home ownership itself. So while a home may be an asset, it also may definitely be requiring a lot of expenses for upkeep. So thank you for pointing that out. And again, recognizing the fact that there's no immediate and instantaneous answer, but instead that everyone is encouraged to apply so that we can begin the process of checking one's individual needs against the stated requirements. All right, and that actually is answering a number of the questions that, in reference, well, if I have certificates of deposit or if I have a retirement account, what I'm hearing you say is that there's not an immediate answer that you can give here today in terms of this dollar amount is too much or these assets would throw things off, but instead, income is what is initially put on the application as a screening tool, and then there may be asset tests that are required subsequently, depending on what the person's household makeup and income looks like. Is that right?
Yes, for an example, I had a gentleman apply for SNAP benefits, and he had a substantial amount located in his accounts, but he was still approved for benefits because he had so many outstanding medical needs. He had so many housing expenses that he had to meet, and his monthly income from Social Security was very little. So they still approved him for benefits, knowing that these medical expenses are going to kick in and he's not going to have anything left over for food. So it gets very specific like that.
And I'd also say that medical retirement accounts are generally not counted, but if they withdraw money from that account, it could be counted. So if they do that, they'd have to verify whether that withdrawal from the medical retirement account is counted as income. That's a possibility.
All right. Well, thank you. And as again, our goal is today to answer as many questions as we can. We're not pretending to know it all and be able to dive into individual specific circumstances. So I really appreciate everyone asking general questions. A person, had said that he had been categorically eligible in New York State and wondering, is that likely transfer to be eligible here in Virginia? Just if we could talk, not specifically about that person, but a sense of when someone perhaps moves to be closer to children or retires in a different state, how does that impact one's SNAP availability and eligibility?
Hmm. So SNAP eligibility is set at the federal level, right? So the federal level, they determine like what your income needs to be eligible for SNAP, but states have certain options they can opt into. Like we know the federal income level is 130%, but Virginia has opted into this program that allows them to expand their income requirement to 200%. So if you are eligible in one state and you move to another state, there could be certain things that change. The amount of benefits could change because maybe that state has a different federal minimum benefit for individuals like yourself. So maybe New York's minimum benefit, I don't know New York's minimum benefit, but maybe New York's federal minimum benefit is higher than Virginia's 23. But when you move to Virginia, you're still only eligible for the minimum benefit. So maybe you were receiving 50 in New York, but when you get to Virginia, it's now $23, right? So eligibility, if you're eligible, you're probably eligible in another state, unless maybe there's some nuances, like certain states have different work requirements as well. Some opt into a waiver. Some say, oh, no, you have to work this amount of time for this amount of days, or certain things like that. So I'm gonna go out on a leap here and say it's not true that if you have millions of dollars in your account, you would be eligible for SNAP. I would be highly surprised if that has happened. But I would say if you move from state to state, you could be potentially eligible. But eligibility might change, the amount of benefits you receive might change. And again, like I said, from that individual example I gave of that older gentleman that did have a substantial amount in his account, it wasn't millions of dollars, but it was money that when the caseworker looked at it and then looked at his expenses and what was coming up, they knew it wasn't going to stay there long. So that's
Yeah.
why that person was
That
eligible.
all makes sense. And you're just pointing out again, individual circumstances make a big difference. It's complicated, and that there are variances from one state to another. So thanks for pointing that out. With again, we're saying the same thing, which is always it's worth the time to apply and to walk through the process, even though it does take a few steps. And it's going to require pulling together some documentation to bring with you as you're either submitting online or in person at the locations that you've mentioned. I appreciate that you've posted some things into the chat. Um, if you would just share those two links that you just put forward, and then I'll ask another question in reference to advocating.
Yes. So here is a link to our pre-screener tool. If you're wondering, all this information sounds pretty nice. I want to see if I'm eligible. Well, click this link that I just put in the chat, answer a couple of questions. All it's asking you is your zip code, your monthly income, how many are in the household, how old you are. And then at the end, it's going to say if you're potentially eligible or not. Go ahead, click that link and see what it says. It doesn't hurt nothing, right? But when you get to the end of that form and it gives you a determination, make sure you follow up with that determination. If it says, oh, it looks like you might be eligible, make sure you follow one of the next steps. Send me a message. Reach out to your local social service office. Go ahead online and complete that application. Because like Brian said, it doesn't hurt anything to apply. It doesn't hurt. And luckily for seniors, they've tried to make the verification process easier with this ESAP program as well. So if you provide them with all your information and you submit your social security number with your application, the caseworker on the back end will be able to do some of those verifications that way without you having to submit a lot of documents. But for those deductions, especially those medical expenses, they may require some sort of receipt regarding those expenses, especially if it's prescriptions or anything like that. Also, I want to bring up that if you receive Medicare, that healthcare premium that you pay for your Medicare that needs to go on your SNAP application, that if that is not reimbursed back to you some way, somehow, that needs to go on your SNAP application so that you can be eligible for the medical deduction. A lot of the times when I'm talking to older adults and I ask about out-of-pocket medical expenses, the answer is automatically no until I start asking some more questions. So be mindful that healthcare premium you pay, that's a medical expense that need to be deducted on your SNAP app. I'm also including the link to Common Help. This is the online application portal. When you click this link, you're gonna scroll down a little bit, click the red box that says apply for all. That will give you the option to submit a SNAP application, along with also apply for any other programs that might support you if you are in need of resources and things like that. So please do that pre-screener link, see if you're eligible. And if you're eligible, go ahead and submit that application. It doesn't hurt to apply.
Excellent. Norm, do you have anything you'd like to add at this point?
No, I really don't. Monica, you did a great job. Covered everything. It was fabulous. Really, really nice job.
Thanks, Norm.
We're agreed. I do want to post what I see as the last and final question of the day. It's in reference to advocacy, and it's so good, you might think that I made it up, but I didn't. This is from Jerry asking to lobby for these programs. Are the eligibility requirements set at the federal or state level or both? In other words, who should we be calling to be effective in supporting SNAP? Now, I'm going to tell you, my AARP Virginia legislative director is going to think, hey, did we put that in as a, way to close out and make sure everybody gets the message and walks away with a concrete action item? But we didn't do this. So, Jerry, whoever you are and wherever you're at, I just want to say thank you. And Monica, if you could close us out by answering this final question. And Norm, if there's anything that you want to add, just flag me down, and I'll make sure I give you a chance to answer as well.
Mhm. So again, SNAP eligibility is set at the federal level, but there are some things you can advocate to your state that they can implement, such as those state options, right? One thing that advocates are advocating for in Virginia is for the federal minimum benefit to be raised to $50. They're also advocating for a waiver in Virginia for telephonic signatures. That way people can submit applications without having to physically sign it. They can do it over their phone or some easier accessible way. In Virginia, they're also starting to advocate for a change in college student requirements. So they want the college student courses to also meet that work requirement. So those are some of those things that are advocated by at the state level. There are certain waivers or options that states have that they can opt into. And one thing that I would recommend is signing up for the food bank's advocacy alerts. I'm going to put that link in the chat. This here will be a great resource if you're wondering who to advocate to about what. We recently posted a blog post on some senior hunger and what's going on and what we need to do to support our seniors and how to advocate to our legislators about that. So I'm sorry the answer wasn't as clear.
No,
But
that's okay.
those state options are what you can advocate for. And let's lead with raising the federal minimum senior benefit here in Virginia to $50.
Norm.
Well, I've got one thing to advocate for is the Virginia Fresh Match. So it was brought up in the presentation, but it's really an opportunity for seniors to get fresh produce at half off. So it's not going to get that anywhere else. But the markets in the front corner markets, but the market at 25th does have that same offer. So you can get all the produce if you're a SNAP benefit for half off. That's really promoting healthy eating. So Virginia Fresh Match is something that a lot of people don't know about who has SNAP benefits, but it really promotes the healthy eating of fresh produce, both at some grocery stores, but also the farmers markets.
Excellent. Thank you, Norm, for adding that as well. Well, friends, this is concluding our webinar right on time. Just to recap, our main goal is to ensure that those who may be eligible at least begin the process by checking their eligibility to begin the application process. And we've listed a number of different ways that individuals can do that. AARP Virginia has been pleased to work with the Federation of Virginia Food Banks over the years and recognize that there are a number of different food banks. Monica is representing the one in Central Virginia, Blue Ridge Area Food Bank. But please take a moment to find your local food bank if you're calling in from Virginia. And as Monica said, jump onto their advocacy email list so that you know what types of issues are coming up that you can help promote and be an advocate for. This ties in well with AARP's livability goals, our work around caregiving and health of all kinds, including brain health. So we really appreciate you taking the time to tune in. We're working hard on behalf of Virginians, both AARP members and their families and the public. And Monica and Norm, thank you so much for lending your expertise and experience in providing the extremely helpful information we heard today. With that, I'm closing out, wishing everyone a wonderful holiday season. Goodbye.
Bye.